We're here today at Premier Total Healthcare with Dr. Popkin, and we're going to speak about peptides. Doc, let me ask you a question I think everybody wants to know. What is up with this peptide craze? What are peptides really about, and are they really good for you?
Okay, well, I think the first thing to do is to explain what a peptide is. So peptides are small chains of amino acids. So amino acids are what makes up proteins. Peptides are just small proteins. And in our body, what peptides do is they're signaling proteins that actually make your body do certain things, like produce hormones, testosterone in men, estrogen in women, helps to regrow and repair damaged tissues like muscle. So what happens is I think there's a confusion as to what peptides are actually being, or how they're being sold out in the community. So a lot of people are selling amino acids and calling them peptides. Well, amino acids are really the building blocks of those peptides, which then form the proteins. So I think what you need to understand is that a peptide should be prescribed by a physician, and you should get this through a licensed compounding pharmacy. Going online and buying the amino acids, which are just the building blocks of these proteins, is really not accomplishing the goal. Peptides are very specific as to what they're supposed to do. For instance, like we use a peptide called BPC-157, and what that does is that helps to repair muscle and decrease inflammation. So that has a specific purpose. Giving yourself just a random bunch of amino acids doesn't necessarily replace the specific peptide and pathway that you're looking to achieve, if that makes sense.
Yeah, so let me ask you in that point, when we talk about these social posts, this craze, stuff we see online, see a lot of pill forms, peptide therapy out there that you can order online. Are those really peptides?
Well, there's a couple of peptides that can be given orally, and one of them is the one I just mentioned, BPC-157. And the reason it can be given orally is because it's made in the gastric juices of your stomach. So it's okay to be given in pill form. But most of the peptides that you see out in online that you can purchase that are oral are really just the amino acids that I spoke about that go into making peptides. So you're not getting specific therapy by doing that. Most of the peptides that we use are injectable, and they're injected subcutaneous, and therefore they form a specific function and purpose.
So you mentioned compounding, obviously injection-based. Is this a prescription form? Is that the best way to go about getting your peptides, obviously outside of the pill form that we see online?
Yeah, so what happens is you can purchase peptides on the internet, and unfortunately you're going to get them from sketchy sources, and in most cases, or a lot of cases, you're not even getting the peptide that they're proposing to sell, because this is not regulated by the FDA. So unfortunately, it is kind of the wild, wild west when you're going online and purchasing something without a prescription. When you get the peptides from a licensed physician, what's going to happen is that's going to go to a compounding pharmacy, which will actually make the specific peptide for the specific purpose. And in that case, yes, it is a prescription, and it is it's you're getting what you're actually purchasing.
And how is that administered? So how often do we take it? Obviously it sounds like an injectable. So how do you administer? How often do you take it? And how often or quickly should I say, do you see the results?
Okay, so it depends on the protocol, depends on the peptide, depends on what we're looking to do. Most of the peptides, they're injected subcutaneously, which means it goes into your adipose tissue or your fat. So you're going to get the vial from the pharmacy, and you're going to get a little insulin syringe, and you're going to draw it up at home and just inject it into your own abdominal fat, which is very easy to do. It's not painful, and you'll administer this. Most of the time they're administered once a day, and we generally cycle these peptides, meaning we will give them to you for a couple of months, maybe 2, 3, 4 months, and then we'll stop it for a month or two, and then we'll reintroduce that therapy. This way your body gets used to the cycling of this so that it actually forms more physiologic functioning as intended.
Great. And also, any side effects? I mean, obviously people want to know what's good and bad about this.
Well, the good part about this is that peptides, It's the signaling molecule that makes your body produce something that it's supposed to produce anyway. So are there side effects from it? There are very little side effects. Just like with anything, you can get problems at the injection site from irritation. There can be allergic reactions, which are rare but can happen, just like with any injectable. But for the most part, what we're doing is these signaling peptides make your body do something that it's already doing. It's just doing it slower. So we're just increasing the signal so that your body can produce more of what it's supposed to produce.
And lastly, if we're obviously interested in putting peptide in ourselves or peptide therapy, how do we go about, what's our next steps?
Well, basically what happens is, it depends on what the patient's goals are, and it depends on what the physician determines actually needs to be done. That's, we want to merge those two things together. So the first thing that happens is, we do a consultation. We talk to you about what your goals are. We do a thorough history, physical exam, lab work, any imaging studies that may need to be done. And then we actually determine if peptide therapy is right for you, which peptides to use, how much to use, how to cycle them, and how to follow the progress through lab work and through follow-up visits. So it's really very individualized, which is the nice part about going to a physician. You're not going to get some cookie cutter protocol off the internet with some sketchy product you're buying on the internet that you don't know what it actually contains.
Well, there you heard it from Dr. Popkin at Premier Total Healthcare. Gave you a little bit of background on peptide, the peptide craze. I think you identified the difference between obviously online form versus going to see an actual physical doctor and what it all entails. So that being said, if you're looking to get into peptide therapy, learn more about it, come check out Premier Total Healthcare, schedule a free consultation, and Dr. Popkin will be more than happy to take care of you.
Look forward to seeing you.